A hysterectomy is an operation which involves removal of the womb or the uterus. There are different ways of physically undertaking a hysterectomy. Traditionally, this was through a cut in the tummy. We can also perform a hysterectomy through the vagina, and that's called a vaginal hysterectomy, and more recently through the advances of keyhole surgery. So there are many reasons why somebody may be considering or have been recommended to have a hysterectomy. If somebody has a cancer of the ovary or uterus, then it may be recommended that they have a hysterectomy as part or all of their treatment. Other fairly common reasons for a hysterectomy may be large fibroids or problems with pelvic pain or heavy periods. A hysterectomy is a major operation, and there are both short and long-term side effects. So one of the short-term side effects can be a complication such as an infection. That may be an infection in the wound itself or in the bladder. Another initial side effect or complication could be a thrombosis, and that's why it's so important when people do go home that they stay mobile and do go for gentle walks frequently throughout the day to reduce this risk. More long-term side effects can be hormonal, especially if the ovaries have been removed at the time of hysterectomy. But it can also be psychological and emotional, and this can be discussed with the gynaecologist or the GP. Probably the most important determinator of how long somebody stays is the type of hysterectomy they undergo. So for example, a hysterectomy that's performed through a cut in the tummy takes longer generally to recover from than one that's performed through keyhole surgery. A laparoscopic hysterectomy, most women would be in hospital for up to 24 hours, but often during the first couple of weeks of being back home, they may feel extremely tired, and I would recommend that they have as much help as possible with day-to-day activities. So most people would start to resume physical activity at around 4 to 6 weeks, with the majority of women being back at the gym, if they've previously been gym users, at 6 to 8 weeks. The earliest somebody would return to work is generally about 4 weeks post-procedure, but many women would not be ready to go back to work till at least 6 weeks.